You're watching Checkpoint. Thank you for staying with us. To some shocking statistics now. And the country's young population believe they are safe from coronavirus because they've not traveled, are young, and that Kenya's relatively warm weather simply will now allow the virus, or will not allow the virus to prosper. The report released by Amref Health Africa also shows that only 4 out of 10 young persons would self-isolate if they got infected with COVID-19. KTN's Beldeen Waliaula now unpacks the report for us and tells us the different ways that the youth have been engaging in sensitizing the public about the deadly virus.
Coronavirus has greatly altered the lifestyles of many Kenyans, especially those living in urban areas. At almost every point of entry, one has to have a mask on and wash hands or sanitize before being allowed in. But for those in rural areas, the effects are a far cry from those in the cities. In Silale village, Kajiado County, for example, this old man rears his cattle, no mask on, totally oblivious to the danger that he could be exposing himself to. But not all are like this old man. At this Manyata homestead, we are welcomed by this lady, who is the eldest wife in this homestead. Even with the water scarcity and drought that is often experienced in this area, there is water at every Manyata entrance. And here, any guest coming in must wash their hands before mingling with people and also observe COVID-19 regulations. Agnes Coches, a mother of 6, says they know about coronavirus through radios, and it has really changed their way of life.
It has affected them, especially going to marketplaces and selling their products. They mostly stay at home. Even visiting each other as it's of Maasai culture doesn't happen anymore.
Even with this, the community has taken upon itself to protect itself from COVID-19.
To protect themselves, they wash hands frequently, even for the guests who come in. Children have become more hygienic and have to wash hands before milking.
Residents here say the government has done little to sensitize them about COVID-19, causing the more exposed residents to educate their neighbors.
They live in homes. It's Manyatas where there are over 50 people in the same place. So how will they even keep social distance or physical distance? It's impossible. The type of culture where you have to greet them or touching them on the head. So how do you say that you'll sanitize every time you're greeting a Maasai child?
Youth Empowerment Network, together with Amref Health Africa, have been mobilizing youth to engage in cleanup exercises.
When you have a clean environment, then you're able to reduce the occurrence of some of these public health emergencies or threats such as cholera. We can observe the right water, sanitation and hygiene, which is very critical, especially now that we are trying to prevent the spread of COVID-19.
In Machakos County, the youth have taken a different approach in sensitizing the masses about COVID-19. Here, they engage the public through social media by sharing information about COVID-19 on Facebook, Twitter, and also Instagram.
We normally encourage wearing of mask when you visit places. Avoid social gathering as much as you can. Kuna zile zenye uwezo, lakini as much as you can, you should avoid them.
We normally target the members of the society. Most likely, most of the older people are in Facebook, so we target the groups. There is the Machakos Political Forum, there is the Machakos County United, there is the Kenya Group Reloaded, where we post awareness about COVID-19.
For the pandemic, the virus must be in existence, okay?
Even though the public still knows about COVID-19, sensitization is still key, especially to the vulnerable groups and disabled.
Kama mimi mlemavu nimekuja kujua mimi niko katika hatari sana kupata COVID. Mimi naweza pata COVID anytime because nimejua COVID inakaa kwa chuma kwa muda gani. Na mimi natumia chombo cha wheelchair to move one place to another.
In Nakuru County, the youths here have taken it upon themselves to learn more about COVID-19. having discussions about how the virus is spreading the community and finding ways to curb the spread. Apart from door-to-door campaigns, the youths here even go to churches to ensure the congregants have knowledge on COVID-19 safety measures. In Nakuru West, we meet a health volunteer during one of her many home visits where she has made it her goal to educate stay-at-home women on matters hygiene.
Tunaona mabadiliko kubwa sana. Watu siku hizi ukifika hata kwa nyumba zake ameweka maji karibu na mlango. Unakuta unanawa mkono kwanza unaingia, ama hata ukienda huko mtu anasimama kwa mlango anakuongelesha ukiwa nje. Kwa sababu anajua ya kwamba hawezi jua umetoka wapi, na anajua kwamba corona iko. Sasa akitoka nje ya nyumba unakuta amevaa mask akisikia kuna mtu anapisha mlango.
Sensitization and resensitization still remain key when it comes to the fight against COVID-19, and more so now that people are getting less and less sensitive every day, yet the virus continues to kill thousands across the country.
To date, we are looking at approximately 1,200 youths across 9 counties, or even slightly more than 9 counties, who have been given an opportunity to help the community, as opposed to simply maybe staying at home waiting for the schools to open or the jobs to be available. At least we've been able to engage 1,000+ youths in the process. With regards to the outreach could be on the on-field or off-field. So in terms of the on-field, since July to date, we are looking at somewhere close to 1 million people who have been sensitized across 9 counties.
According to a report by Amref Health Africa titled Lived Experiences of Youths During COVID-19 Pandemic, shows that 74% of people aged between 18 to 34 years believe their risk of contracting COVID is low. Of the 74%, 43% believe they're safe because they don't travel, while 10% believe they're safe from the virus since they're young. According to the report, if asked to self-isolate, only 4 in 10 will do so.
People between 19 and about 40 contribute about more than 70% of our infections. So it means that in terms of controlling the force of transmission, these are the people who need to own the measures so that they know that actually we need to save those people who are at high risk.
Due to COVID-19, young people are faced with unimaginable threats related to education, employment, access to health care, and lack of disposable income. And this is where the Youth Empowerment Network has stepped in.
Kenyans are aware there is COVID-19 epidemic in Kenya, but it will be very important if we sensitize them to know how to wash hands, on how to put on masks, how to dispose masks.
However, the government still has a lot to do, especially in applying effective mechanisms in fighting the virus by engaging the youth in the country in a bid to build resilience and expand social protection to avert negative effects from the pandemic. Beldeen, Waliaula, KTN News.
That story